wasn't that bad at all. So actually it was my easiest injections that I've had done. Good morning. This is my second week here at Caring Medical. The weather today is very dark and gloomy. There's been a big storm and a tornado warning. I think we're gonna be okay, but my body has really been feeling it today, and I woke up in the middle of the night in a lot of pain from the storm. We joke that I'm kind of like a human barometer. I can always predict when a storm is coming on. Hopefully tomorrow we'll be able to go out and maybe do something fun. We brought the wheelchair with us, so this past week we were able to go to a couple parks and just go on little nature walks. So that's always nice to get some fresh air. Wow, oh, wow. Okay, so there's a screen right here that's keeping it from being open air, but it is really coming down. My body does not like it, but I love the sound of the rain, so. After the storm, we decided to take a little drive to the beach. And as you can see, it was very windy, but it was beautiful.
It's real windy.
Metal detecting. Oh, it's looking good. You guys know those days when it just feels much harder than others to push through and just live with chronic illness. Today is one of those days for me. I don't know, just having a rougher time today physically and emotionally, but we're hanging in there. And thankfully today I don't have any appointments or anywhere we need to go, so if I do just end up staying in bed all day, then that's just fine. But I just wanted to make sure that I share some of the downs as well as the ups, just because this journey isn't easy, and obviously we aren't alone in this. So if you guys are having an extra rough day today too, then you aren't the only one, and I'm with you in spirit. So yeah, I'll catch up with you guys later. My first appointment of the week will be tomorrow. That's about all that's going on around here. This is me just doing my neck weights. I just fold it over like that and drape it behind my back and stand for about a minute. Yesterday we figured out that I'll be having my first round of Prolotherapy injections this Friday, and they let me know that they left enough of a time slots for me to be able to have PRP done if that's what they decide to do. So I'm not sure whether it's just going to be the regular Prolotherapy or the added PRP, which is where they draw your blood and spin it down and inject it back in. I'm starting to feel a little bit nervous about the treatment, not because of the pain of the injections. I pretty much know what to expect in that way, and I guess I feel pretty confident that I can handle it. It's something that will be, you know, quick and over with pretty soon, and so I try not to get nervous about that sort of thing and just take it as it comes. But I am nervous for the afterwards, hoping that I won't have any sort of reaction or anything like that. I had a pretty rough flare-up in just my general symptoms last time I had PRP done, but I think it's gonna be okay and we'll just take it as it comes. Yesterday was just a rough day for me. It had nothing to do with the treatments that I'm having here, but it was a rough day physically, and it was just one of those days where it just felt harder than normal to push through symptoms and just to keep going. Chronic illness is just a lot. All of you that are going through it, just know that I feel for you and you are certainly not alone. In a little bit here this morning, I'll be heading to my chiropractic appointment. I'm not sure if they're doing curve correction as well, but I'm feeling good about those appointments, not feeling nervous about them anymore. I trust him and the neck weights are continuing to go well. Like I said in my last video, they actually feel kind of good when I'm wearing them. It's just hard because of POTS to stand for that long, but I've been keeping up just fine with those. Something else that I was gonna mention is yesterday I realized something that I thought would be a good way to explain like how I'm doing and how I've improved. So when I was bedbound and at my worst, I would say I was at about 1% battery energy wise and functionality wise. Like, let's say the bed is like your charger. However long you can last on 1% battery being unplugged, which is obviously not long, was where I was at that point. I had to be in bed almost 100% of the time, and when I was out of bed, my battery was very quickly depleted to 0%. Well, I would say I'm at about 10% now, which is a huge improvement from where I was before, but it still shows that I'm super far from being to like that 100%, which is obviously the goal. It's hard to come up with those numbers because when you think about, for example, when I was at 100% for me was, I could go on a 26-mile hike. I can't even do 10% of that now. So it really depends on, you know, whether you're talking about functionality, symptoms, pain. It's hard to know like what percent you are normal, but just for explanation purposes, I'm gonna go with about 10%. That's my best estimate of where I'm at right now. So obviously still very low functionality wise, but much higher than the 1%, which was almost no functionality. So I think it's a good way to explain, because when you say you're doing a lot better, a lot of times people will think, oh, like you're doing all better, but I don't know if any of you guys relate to that or think that's a good analogy, but super thankful that I am not in such a dire situation as I have been in the past, and it's something that I don't take for granted. But I do think I need to be gentle and understanding when I feel frustrated and discouraged, because I still am really sick and really struggling. So there are a lot of ups and downs on this journey, and I know you guys know that. I think that's enough for now, so I'll update you on how my appointment goes in just a bit here.
Good idea, good idea.
We just got back from my appointment a couple of hours ago, and it ended up being a curve check appointment. So basically he was just looking on the x-ray before and after, wearing the weights and adjusting the weights if necessary. Something that we've noticed so far at our experience with Caring Medical is that I don't think any of our appointments have actually happened on time. I think we've waited on average 45 minutes to an hour for the actual appointment to happen since we've gotten there so far. But it's totally fine, because that's what we're here for. Just something to keep in mind, they do have tables in their rooms if you're not able to sit up for a longer period of time. A lot of times I will lay on their table and turn the lights out. That can help with managing symptoms and overstimulation, but the appointment went well. It was really cool to see on the x-ray because there was a noticeable difference in my neck without the weight on this week versus last week with just 1 week of doing the neck weights. So first I just stood there and he did the x-ray without the neck weights on, and then he put on the 3-pound neck weight that I have been doing, and he said that on the x-ray that made the curve slightly better but not where we wanted it to be. Then he asked if I felt like I could tolerate trying a little bit heavier weight, and I said sure, I'll try it. So he got out a 5-pound weight and he put that on my neck again while doing an x-ray, and he really liked the way that my curve looked when wearing the 5-pound weight versus the 3-pound weight. It really made a difference. It is harder for me to hold the 5-pound weight, but it's doable for me at this point. We decided to go ahead and try switching to the 5-pound weight instead of the 3-pound, and it won't be as much time with wearing it, so I'll just be doing 5 times a day, 1 minute each time, so it's about half the time that I was doing with the 3-pound weights. But he afterwards showed us the x-rays from last week and then from this week, and the difference between me without any weights on within just a week of doing the neck weight therapy, and then also the difference between me without the neck weight on and the new 5-pound weight. And that was really cool to see. To me, it actually looks like my vertebrae are in a better position. And I'll show you guys, I took pictures of the screen that they had there. I don't know if they'll eventually send me those x-rays or not, so I can show you guys a clear picture of what it looks like. This is me from the first appointment without weights on in the neutral position. And this is me this week wearing the 5-pound weights. This shows a better side-by-side comparison, so as you can see it's pretty different. So my neck is being pulled back quite a bit with the weights, and to my understanding, after they get my neck back from being too far forward, then they will try to work on restoring that natural curve. Here you can see the instability in my neck even just in the neutral position, but then on the right with the weight on, you can see that they align on the right really well. Pretty amazing, right? You can definitely see my curve being pulled back, and that's really cool to see. It looks like my vertebrae were like aligning better, and so that's obviously a really good thing. I just feel really excited that just doing a week of these neck weights has made a difference in what my curve looks like on the x-ray, and it's just cool to me that they really show you that progression as you're doing treatments. And of course the goal is to help with symptoms and quality of life, but it's awesome to be able to see these objective measurements and see them change as you progress with treatment. And I know I'm still really early on, so it's an exciting thing. So something that I've noticed since I've been fused C0 to C2 is if I'm looking like directly, if I'm trying to rotate my neck like directly, I'm using my phone like it's my neck, but directly to the right or the left, it feels kind of like a hard stop, like it's not possible to go. So if I go like straight left, there's not much any at all, but then if I go slightly down and left like that, or down and right like that, then I have some more range of motion. And that's something I talked about last week. After the adjustments, I was able to notice more range of motion in a way that didn't seriously aggravate my symptoms, so that's a good thing. But he told us that because I'm fused C1, C2, I'm getting that movement from down lower in my neck, and so that's why I have to slightly look down to turn my neck like that versus just going straight to the left or straight to the right. That just made a lot of sense to me. It was something that had really never been explained to us, so we were thankful for him explaining that. On Thursday, I will be having an adjustment without the curve correction, and that will be before my first round of prolotherapy on Friday morning. And I think the reason why they do that is to try to get you back in the best position possible before going ahead and doing the prolotherapy injections. And after the injections, they're going to have me hold off on the neck weights for a certain amount of days because you'll be significantly swollen and sore. You won't be wanting to do the neck weights for probably 3 or 4 days after, so I'll keep you guys updated on what they tell me with that. But looking forward to starting with the prolotherapy, and I'm excited to see where it takes me. Still very hopeful and feeling very thankful that we have the opportunity to come here. So in just a little bit here, I'll show you guys the 5-pound weights so that you can see the difference. It doesn't really look much different, it's just a different color and slightly bigger. That's the main update. Tomorrow we have no appointments, so just a rest day. Thursday we've got an adjustment with the chiropractor, and Friday morning I have the prolotherapy injections. So the red one is my first 3-pound one, and then the green one is the new 5-pound one. And then the strap that I use is just the same, so I just velcroed it and put it on. Here's me putting on the new weights, and I'd wear it just the same as the 3-pound one. We try to get out almost every day for some fresh air, whether it be a little nature walk or just going for a stroll in the neighborhood we're staying in. But the weather's beautiful and there's lots of great parks that are accessible, so we enjoyed this a lot. We met a guy named Mike who is a local and a photographer, and he was telling us all about the wildlife here, and he actually said that there's another girl who often comes out here who used to wear a neck brace but doesn't anymore, and she moved out here for treatments, so I'm guessing there's no chance it isn't for Caring Medical. He took us on a little adventure to find the alligator that lives there, and here it is. It actually has a bunch of babies, but we couldn't find it this time. We'll have to come back again soon. I just got back from my chiropractic appointments, and today is Thursday of week 2 here at Caring Medical. I feel like every time I come back from an appointment there, I have something that I'm just like, oh my gosh, I can't wait to talk to you guys about this, just because I feel like they're just so knowledgeable, and I've been learning so much just from my first 4 appointments there so far. So today he did an adjustment on my neck with the machine, and also just like by pressing in certain places with his hands, and all of that went pretty well. We had some interesting conversations with him about fusions. Jake asked him about why when I extend my head back and try to go back, I can't go that far, but when I do the extension motion, it causes severe pain, and so much so that it makes me nauseous and dizzy, and it almost feels like a shock goes through my body. And he said that it could be from the instability, because there is instability. He pulled up my imaging and showed how my vertebrae were not aligned at the top, but he also said that it could just be the fusion itself causing extra, I don't know if I'm remembering this right, but I think he said extra force on everything else down below it in the hardware. I can't remember exactly what he said, but we kind of got into a conversation about like, can you remove fusions? He said that they had a patient that had a C1, C2 fusion, and they actually had it removed. They were having a reaction to the metal, so it was a big step in their healing to have it removed. And I just thought that was really interesting that they had a patient that had done that. It's just an interesting concept. When I first went in to see Dr. Brian last week, he said, you know, you're probably not going to be 100% because of your fusion, because of all the metal that you have in your head. And he said realistically it may be more like 75. We're gonna aim for 100, but just know that it's more likely that it won't be 100%. Of course 75 would be incredible and I would love that, but it is still kind of hard to hear, like, because of this fusion that you have, you know, the chances of you getting to 100% are a lot less than someone that doesn't have a fusion. As you guys know, it's something that I've struggled with, and something that if I was given the option to go back, I definitely would come here first. But like I always say, it was part of my story for a reason. It felt right at the time. I'm trusting that God knows better than I know, but that doesn't make this easy. The fusion for me is a source of anxiety. It's something I worry about for the future. It's just a hard thing for me to think about, but continuing to do my best to trust in God and knowing that it was a part of my plan for a reason. Jake thought that was cool, and he was like, well, if you don't get better, like, we can look into that and consider that, and it might be a good option for you. And I was just like, I don't know. At the same time, I would love to get rid of the fusion in a heartbeat if I could. So if I knew it was safe, I might consider it, but I'm sure it's pretty risky, so it's not something that we're really actually looking into, but just an interesting conversation to have. The adjustment went well. In a weird way, it felt kind of good. I gotta get my brace back on here. But yeah, this morning I felt rough high pressure symptom wise because of the storm. What was interesting was that there wasn't a storm that was shown on the forecast when I looked on my phone, but when we went outside to get in the car and go to the appointment, the sky was super dark in the distance, and I was like, wow, I really am good at predicting those storms. I may end up doing 2 videos for this week, depending on how much filming I do tomorrow with my injections. That'll be my first round of injections here at Caring Medical, and I'm feeling a little nervous, but I'm excited and thankful that we have the chance to be here, and I'm looking forward to meeting with Dr. Hauser again and asking him some questions and just continuing to learn more. I'll be sure to share with you guys as much as I can possibly remember. I hope that these videos are helpful for you guys. Always know that I'm not at all trying to convince anyone to have any sort of treatment. This is just me sharing my experience in hopes that will be helpful for some. But if for whatever reason you do decide to have treatment with Dr. Hauser at Caring Medical, be sure to let them know that Rachel from YouTube sent you their way. And several of you guys have told me that you are either here right now or coming in February or whatever it may be. If you see us there, please say hello. We love meeting you guys and getting to know people that are going through similar things. So okay, we're on the way to get my first round of prolotherapy injections. I'm kind of hoping that they will just do prolotherapy and not just PRP, because he does so many more injections, at least from what I've heard, than the other doctors I've been to. So I'm a little nervous, but ready to get it over with. It really wasn't that bad at all. So actually it was my easiest injections that I've had done. Dr. Hauser was the bomb.
Rachel's neck, after injected, looks quite red.
It's very stiff. Okay. I've got my heating pad. So after prolotherapy or PRP or any kind of regenerative medicine procedure, you typically are not allowed to have ice or anti-inflammatories like ibuprofen, because the inflammatory process is really important to this type of treatment. You're essentially creating an injury in the soft tissue so that your body will know how to respond and heal in those areas and strengthen. I think Tylenol is fine, and I don't know what other medications. I don't really typically take medications. That's not really a big problem for me, but I do use ice like a lot, so it will be hard not to use the ice, but I'm glad I have this heating pack. Anyways, back to the procedure. So I was pretty nervous this morning, to be honest, because a lot of people had told me that Dr. Hauser has a really aggressive approach and that the treatments are intense. And he also does a lot more injections than most other regenerative medicine doctors. Last time I had injections, I almost fainted several times and almost threw up, and it was just a really not fun experience. But obviously, you know, in the long run it didn't matter. I was surprised because it was actually not bad at all. Like it hurts like quite a bit, you know, like painful for an injection wise, and I think I had about 80 injections, and because I'm fused C0 to C2, I had C2 and below. If you don't have a fusion and you're having the full C-spine, then I think you're gonna maybe have over 100 injections, but he's so quick, like so quick in comparison to the other two doctors that I went to. And so honestly, afterwards I was just like, really? Like that was it? That wasn't bad at all. I decided not to take any of the numbing medication or pain medication or laughing gas. They even offer sedation if people need that, but I figured I would be just fine. And the treatments I had in Utah were the most painful, but they didn't make me feel super sick. But the treatments in North Carolina that I had were less painful, but they made me feel much more sick, which at this time it was like not bad at all. I really think Dr. Hauser is just the best of the best, and it shows with how many injections he does that his approach is quite different than most that do prolotherapy. Not to say that you can't have success with going elsewhere, because you totally can. I had good improvements with PRP done at a different regenerative medicine clinic, but I think that Dr. Hauser's approach with the neck curve weights and also the aggressive prolotherapy or PRP treatments, whatever he decides is best for you in your case, I think that combination just really tends to work a lot better for people that have complicated neck instability cases. In the lobby when we went in, it says treating the most complicated cases, the most difficult cases, and that really seems like what they're doing there. We ended up deciding to just go with prolotherapy, and they have a solution. Hold on, let me see if I can find it. I couldn't find what it was called, but they put something else in with the dextrose prolotherapy solution that is supposed to help the platelets rush the area to help with healing. I hope I'm explaining that right. It's something that I don't think all regenerative medicine doctors use, but they typically use it here. It's possible to get treatments without it if you want to for whatever reason, but I think it started with an A. I can't remember what it was called. I'll have to ask again at my next treatment. Basically, we went in to the next center, sat in the waiting room, then Dr. Hauser came out into the waiting room and talked to me really quick about procedure, asked if we had any questions, and then the nurse came in and took us back, and she was so sweet. She went through everything and made sure we were comfortable and good to go, and I told her that I sometimes get queasy with needles and have like that vasovagal response where I might like pass out or feel like I'm gonna throw up, whatever it is, that I just really can't control. And so I wasn't super worried about the pain, but that was something that could happen. And she like got peppermint essential oil and rubbed it on my wrists, gave me a little pad that had peppermint on it for me to sniff during the procedure when I was face down on the table getting the injections. And for me, smelling peppermint can help with nausea, and she gave me a gown to put on so that my shirt wouldn't get any blood or prolotherapy on it, I guess. He actually didn't use x-ray guidance for my procedure because mine was C2 and below. I guess he typically uses guidance when doing like the C0, C1 area because that's obviously such a important and critical area to get right, but he's so experienced that he doesn't need to do guidance, and he was just saying that like he knows the anatomy so well that he really just doesn't need to have the guidance. We were okay with that, and actually it was like a third off of the price because I didn't have C0, C1 treated, and so that was like a nice surprise. It actually ended up not being much more expensive than the prolotherapy treatments that we had done in Utah, and so I was happy about that considering how much we're having to spend on this trip. I feel like I learn something new every time I go here, and so that's why these videos are ending up being longer than I ever expected. But I just want to share with you guys as much as I possibly can, because when I was looking into getting treatments here, I felt like there wasn't a lot of like patient experience information out there. Obviously there were plenty of testimonials, and I had talked to a lot of people who had been treated here and had good results. Caring Medical has tons of videos done by their doctors explaining their approach that are amazing to listen to, but I think there's something to be said about hearing what the actual experience of like going to the clinic and like how the appointments go and how the treatments go. I hope this is helpful for you guys in some way. I'm going to go into as much detail as I possibly can with like what I learned and what I experienced here, but I asked him if he thought there was a connection with instability and tethered cord syndrome, and also with like the compression syndromes that a lot of people with EDS have, like MALS or SMAS or May-Thurner, things like that. He seems to think there is a big connection with instability, sometimes even lower spinal instability with those conditions. I would really think it'd be interesting if he would do a video on his thoughts on tethered cord syndrome and what the possible connections are with instability. He also said the more stretchy you are, aka EDS, the less successful surgeries tend to be, and so I honestly had to agree with that. So it seems like procedures like this really should be a first resort, and it makes me sad that there's really only one place in the world that has the approach like they do. There are plenty of other great regenerative medicine doctors that are really helping people and doing amazing things, but a clinic that's completely specialized in neck instability is a very rare thing, and I think Caring Medical is one of the only ones. Eugenics in Colorado also has a special procedure called the pickle, where they go in from the front and do stem cells, and I have my reasons for why I decided to pursue Caring Medical over Eugenics. Obviously because I'm fused, that wasn't an option for me to have the pickle anymore. I just call it the pickle, but it's PICL. I couldn't have that procedure anymore, but I really just felt better about Caring Medical's approach after researching both Regenix and Caring Medical. I always encourage people to do their own research and just do what feels best for you, obviously. So back to the treatment. After I did the consent, I went face down onto the table, and he did all the injections, and kind of feels like he's scraping up and down with him, but he goes really fast. Like the 80 injections I had, I think it was like probably 5 to 8 minutes or something. I don't know, it's hard to keep track of time when you're just like laying face down being jabbed with a bunch of needles. It was probably half the amount of time my last PRP treatment lasted with a different doctor, and twice as many injections at least. So just to give you an idea of how quick he goes. He's just so experienced with it that, you know, I think it's just like second nature to him. And obviously when you're getting poked with so many needles, you just want it to be over with quick. And then they just had me lay down for a while. They got me a heating pad, and I just laid down there for probably 5 or 10 minutes, and they were monitoring my heart rate and blood pressure during the injections and after. They made sure I felt okay enough to sit up, and they have like a rule with their neck patients that after the procedure you can't sit up without somebody helping you, and you have to be wheeled out in a wheelchair and stuff like that. I think that's just to make sure that you don't faint, just to be extra cautious. We had a good conversation with Dr. Hauser afterwards about tethered cord and compression syndromes, and it was just interesting to hear some of his thoughts on those things. By the time I sat up afterwards, I was starting to get really stiff. I'd say the best way to describe what it feels like after you get the injections is it feels like you're wearing a neck brace without actually wearing a neck brace. Somebody else I was talking with described it as that, so I didn't come up with it, but after he said that, I was like, yeah, that's exactly how it feels. So in a way it feels good, but it's like super sore and stiff, but very manageable. It just hurts a lot to move, and it's hard to move. Like a couple of hours ago, I was like laying down in bed. I couldn't get up without Jake's help just because like moving was so hard. So like if I take my neck brace off, yeah, it's like no difference in how I feel. It's just so stiff and swollen. So I think all the inflammation that is happening kind of makes it like a neck brace, but I'm just gonna lay against the heating pad. Overall, it went really as well as it could possibly go, and I'm thankful for that. Based on how the injections went this time, I am not gonna be nervous at all to go to my next treatment. And I may end up doing PRP the next time. I may end up having my jaw treated. We're gonna ask more about that. We'll see. I'll let you guys know how I feel tomorrow and the day after. I think in past treatments, I think the second day might be like the most stiff and sore. It definitely feels manageable, and something that I always like to remind people of when going through stuff like this, like if you're having these injections and have instability and live with severe chronic pain and symptoms, then having these injections really is not much in comparison to what you've already been through. And that's kind of what I was thinking. I was like, I would take these injections all day over like some of the other medical experiences I've had. Don't be too worried about it. If you're going to be having these treatments, they're over pretty quick, and someone else called it productive pain. I think that's a really good way to put it, is that it's hopefully gonna be really worth it. So anyways, I will stop rambling about this and get some more rest, but that's the update after my first treatment. All is going just fine over here. So today is Monday. I'm still in the same place that I was in when I last checked in with you guys on Friday after the injections. The weekend went fine. Nothing crazy, awful, or scary happened after I had the treatment. I would really compare the pain to like having a gigantic bruise in the back of your neck. Like I can still feel it when I sit up and it feels swollen, and when I put pressure on it, like it feels like a bruise would feel. And so I would say the worst of the extra stiff and soreness was the day of and the morning, afternoon after, and then after that it started to go down and improve. So it wasn't hurting as much like with every little movement that I made after that. I just rested a lot this weekend. I did not have much of a flare-up of overall symptoms, which I was really thankful for. A sort of reaction. This week I don't have any appointments until Thursday, which is going to be a chiropractic adjustment appointment. They said that they could fit me in if I felt like I needed to see the chiropractor for whatever reason before that, but other than that, it's really just a rest and recover sort of week, and I won't be starting my neck weights again until I think Wednesday-ish of this week. So I've been taking a break from that, which makes sense because of how swollen and inflamed and stiff my neck is. But I'm gonna continue to get as much rest in as possible. Honestly, in a way, it really, at least for me, feels good, like with the inflammation, because it feels like my neck is more stable. And so I don't want to speak too soon because I know that it takes a really long time to heal and often takes a long time to see significant results, but it's easier to hold my head up without my brace on right now because of how stiff my neck is from the inflammation. So I think that's a really good sign. And another thing that I wanted to mention is when I had prolotherapy done by a different regenerative medicine doctor, prolotherapy, not PRP, I did not feel anywhere near as stiff afterwards, and I did not have any results really at all from the prolotherapy, but when I had PRP with the other doctor, I felt really, really stiff afterwards. And I would probably compare the stiffness level from PRP from another doctor to the stiffness level from just getting prolotherapy with Dr. Hauser. And so there was a big difference in how I felt after the injections with Dr. Hauser versus a different doctor. I'm curious to see what it would feel like to get PRP from him. I'm guessing the stiffness and pain and stuff like that would probably be a bit more than what the Prolo was, but when I was talking to him before the appointment about deciding between Prolo and PRP, he was like, whatever you decide to do, it's not going to be a weak treatment. The most important part is the needle of any type of regenerative medicine. So that was just cool to hear. So they've decided to do 3 total Prolo treatments on my neck while here, about 2 weeks apart, like 13 or 14 days apart. So we'll have one right before we leave, and then we'll take a break for a couple months and likely come back for about 3 more treatments. So that's the general plan. I have a feeling that this is going to really help. So I will keep updating you guys on how things are going. I plan to continue the weekly videos, just sharing my experience with all my appointments and how I'm doing overall during the treatments. Thank you guys so much for all your support and encouragement. It really means a lot to me. I hope you guys have some lower symptom days this week. I'm always rooting for you and wishing the best for you. So I'm gonna wrap it up for this week, but make sure you subscribe if you haven't already, and I'll look forward to seeing you next week. Bye.